I'm not here because I had great accomplishments. I'm here because I'm a storyteller, and I'm going to tell you my story. So it's based on science and research because it's been a successful medical journey, but it started a long time ago. And when I was asked to speak tonight, I was asked, can you look at it through the lens of your gender? And as a woman, how was your care and how was your journey? And it's interesting because absolutely there was no difference in my care once I was diagnosed. Where it was tricky was getting diagnosed. I was in my late 40s, I had a great job, it was very demanding. I had 2 fine kids and they were very demanding. I had 2 dogs and 1 husband, and it was a busy time. And I had a lot of symptoms. I had headaches, I had sleeping problems, I was susceptible to hot and cold, I was anxious. And it's hard as a woman because you dismiss it. You think, oh, I'm just too busy. I have too busy syndrome, or as Ellen DeGeneres says, TBD, too busy disorder. And I got myself a new pillow for the headaches, and that didn't work. And when I went to the doctor, I was embarrassed and I was awkward because I thought, this is nothing. And, he said, it's stress. It's stress. And I thought, oh, I'm failing stress, because I thought I was someone who didn't do stress, and I don't do jet lag, and those were my 2, claims to fame. And then I was stressed because I was failing stress, and it became a cycle. And incidentally, I was diagnosed with a pituitary tumor. It happened because I was being treated for a modest, lucky cancer. And at the end of it, when they did a CAT scan, he said, the good news is there's no basal cell carcinoma left. The bad news is you have a pituitary adenoma. Now, I'd never heard of that, but in one sense, I was relieved because I had a disease and I had a situation, and I wasn't just not handling stress well. With that came a whole, this was 16 years ago, so it was a long, long process. And in that moment that I was diagnosed, my life changed, and your life pivots. There's a point that you say, okay, things are different. I started the journey, I had transsphenoidal surgery, and you may have seen from Dr. Einstein's slide, there's the pituitary there, and it's right in the middle of the brain. So because research had been done, they tried to take it out through my nose. When it was over, the doctor said, it was good, but we had to leave a particle in. The particle, because it would have been too dangerous to keep going, but the chances of it growing again are 1 in 5 million, and that was the lottery I won. So it grew back, it hemorrhaged, I then needed a craniotomy, that didn't work, and oh, I have a picture of, here I was at Princess Margaret, 5 years later, getting radiation, and I took the nurse took this picture. I came out, my daughter met me, and she said, we're going to post this picture. So it is a cool picture of radiation, and that helped, that contained the tumor. But what I wanted to talk about in terms of my journey was it all happened at the peak of a career I loved. I was at United Way. I then started working at Mount Sinai and at Sick Kids. And for anyone who's ever been in a hospital, you always see a plaque on the wall that says, we are family and patient-centered care. I saw it when I gave birth to my kids 30 years ago. And it's fairly meaningless. No, it's a really nice notion, but it's not a practice. It's becoming a practice. But my first days on the job in the hospital, I went with my boss to emergency, and I'm the head of communications, and we go in, and there is a sign that says, we are patient and family-centered care. And then there was this big sign with letters in bold print, all caps, kind of yelling at you, and it said, you will wait. And that's the way I interpreted it, and I said, oh, we should probably fix that so that it's a little nicer. And he said, oh, you're responsible for communications, it's not your problem. And the sad part is, he believed it, but it is our problem. So I think what I've been able to do is take my experience as a patient and in a limbo of waiting and waiting for the right treatment and sort of translate it in a way that's meaningful about what it means to be a patient and what we should be doing. And with the vantage point that says, I was once a healthcare executive. I sat at those tables where we worked on metrics. How many people come into ER? How fast do they get out? When do they get a bed? Will we see them again? And then I put on my blue hospital gown, which is democratic and universal, and honestly, the only metric that mattered was treat me like a person. The rest of it goes by the wayside. I had a third entry into care when my husband was diagnosed with cancer. While I was getting my radiation, he was diagnosed, so we had 4 months of daily contact at Princess Margaret getting radiation. And I saw from the caregiver perspective just what healthcare means. So that's why I am proud to be someone who can try to translate for clinicians, for policy, and for all of us what it means to be a patient. And what it meant for me is that I could make my experience somewhat valuable and somewhat useful and try to make a difference. Because otherwise, you're sidelined and it's hard to know what to do. Now, I'm a grateful patient. I got extraordinary care, and I was absolutely confident that I would get care like that. We're lucky to live in Canada, in Ontario. We're really lucky to live in Toronto, where there's this intersection of great caregiving organizations. And the care itself is kind of like a solid brick. The problem is that the brick has mortar between it, which is cracked and uneven and sometimes smooth and sometimes completely baffling. And I kept thinking as I was trying to navigate the system, I'm of the system, I know who to call, I'm not shy, I speak the language, but I wondered for people who don't speak the language and don't have the tradition of healthcare here, how do they manage? There's so much pressure. Everybody I know who goes into healthcare is doing it for the right reasons. They all want to help people, and they're humane, and they're caring, and they get training like that. But somehow the pressure of administrative duties, the pressure of timing, the pressure of being in an organization, it gets ground out of them, and they forget the very basic things. I was always saying, it's so simple. You do the hard stuff like brain surgery, but just remember that you need to communicate with people, and they'll be able to be better patients. I can't believe nobody else was this dry here. I get more time because I have technical difficulties. So, and I'm up here. So I'm going to give you some examples of where communication fell down. I was released from the hospital and told in 6 weeks you'll come back for your follow-up visit, and I never got a call for the follow-up visit. So being shy, I called for my follow-up visit, and the nurse and I had this, or the administrator had a strange discussion where she said, oh, no, you don't get a follow-up visit unless you've had surgery. And I said, well, I did have surgery. She said, no, according to the chart, you had an MRI on June 9th. And I said, according to the 42 stitches in my head, which I can show you, I had surgery. But I kind of wondered if you didn't call, what would have happened? At one point, the doctor who had been working with me for 15 years came in for our regular appointment that we had twice a year with my file in his hand, and he said, so who are you? What are we talking about today? And I was so hurt because I don't expect him to remember me. He does thousands of heads a year. But I thought at least he could look at the file before he walked in and pretend that he knew who I was and what we were doing. There are countless examples of that thoughtfulness. One doctor was so busy looking at my head on a screen, he never glanced up at me, and I said finally, don't you want to see what the packaging looks like? Because, you know, and it isn't that he's a mean person or that administrator was difficult. It's they're overwhelmed and they forgot the basics which all our parents taught us. Our parents taught us to treat people like you want to be treated. It is as simple as that. I went in for an appointment with my radiation doctor, and he stunned me because before we got started, he said, so how are the wedding plans going? And I thought, wow, I'm a person in front of him. It's not just let's get on with the business. At one point, my husband had an MRI to check how effective his surgery had been and his radiation. And he was to see his doctor on a Tuesday. On Friday afternoon, the doctor called to say, just wanted you to have a good weekend. I took a quick look at the scan. It's looking great. And what that meant was you were being treated differently. You were not just being treated in a hospital that treated a disease. You were a hospital that treated the people who have the disease. I know a woman who got her diagnosis of cancer as she was driving in her car and told by the doctor to pull over. And so she's sitting in a Home Depot parking lot. and she gets a diagnosis of terminal cancer. So there's the span and the system of all of these differences. And it matters so much when someone treats you like a person. Like you're more than just a bunch of cool symptoms or a procedure that's interesting or a case study or a file. You are the person inside. And that is so deeply meaningful. A nurse came in one night and we were talking, and I had double vision at the time and a patch over my eye. And I said, you know, double vision isn't so bad when you go and you watch fireworks because you just take off the patch. And I didn't need LSD. I had a whole panoply of, or constellations on a dock. And when I woke up in the morning, on my bedside table, there was a greeting card with fireworks on it, and a really sweet note from her, and I've never seen her since. Someday I'll find her in an audience and say, that meant so much to me that she thought, well, she's wearing a hospital gown and she's in a hospital bed, but she's actually an individual who has feelings and thoughts and ideas and a life and fears. Right now, there's a big movement in ramping up the patient experience, and I think that's very important. And I know when I've been working with UHN, we had a conversation and I said, it's nothing magical. It's like the 3 A's. It's acknowledge the patient, ask what they want, and act on it. And if you do that, you make eye contact, you make connections, and you can be a better patient for your clinical partner. I think the days of the paternalistic care package are changing. And as a patient, you have a responsibility, and as a partner, you can forge a much better quality of your care. I'm running out of time, I know, but I did want to talk a moment about research. I have been so fascinated by the research we're hearing and the work that I've been doing lately, working with researchers. And it's interesting because as a patient, the research is largely invisible. If you're on a clinical trial, you will know you're in a research trial and you'll see the research. But all the steps along the way for my care were research-based. To discover how to take a tumor out through your nose, to discover how to open up a head and find a tumor, to discover how to radiate and chemo. All of these things involve years and years of research. And I think right now, we're finding out wonderful things about the brain so that when you have an illness, it's not a death sentence. It's a way to accommodate and learn. I was at a research fair last week with researchers from across Ontario, and I actually saw them growing brain cells in a petri dish that came from someone's own body. The regenerative medicine is amazing. So we're lucky to live at this time where it's coming to fruition. I have been blessed with great care. I have loved being able to participate in the discussion around how to provide humane care and not just great care. And I always like to leave a talk with all the notes that I meant to read, but also a comment by Maya Angelou, who has really captured it when she said, at the end, people won't remember what you did, but they'll remember how you made them feel. And I think that is so true in healthcare. So I hope I've made you feel relaxed watching me fumble. Oh, and wait, one thing. Here we are. The other thing that happened was while we were getting treated back-to-back for radiation, my daughter magnanimously said, we'll postpone the wedding. And I said, no, you don't do that. You hang on to the joy. So a month after my husband finished his treatment with his feeding tube in and his radiation and chemo done, and there we are. We had a wedding. And it was really fun. So I'll just tell you the carrot cake muffin story. So he asked for carrot cake muffins, and we reminded him that he had a feeding tube in and he couldn't eat them. And he said, no, he wanted to bring them to the technical staff because as he was getting radiation, they always asked what your birthday is. That's how they know you're coming in, not because you like radiation, but because you need it. And they'd made a big fuss about his birthday, so we brought in carrot cake muffins for them because they had treated him like a person, and we wanted to give back because we were so grateful for that kind of care. The other aspect of it is everybody is in healthcare part of a team, and every member of that team has a big role. I was thrilled that the receptionist for Princess Margaret this year was named Toronto's most important person because she is. She's like a greeter there. Makes a huge amount of difference. So I thank you very much. I apologize for the technical fumbles, but my son-in-law would know I can't help it, and it just happens. And it's a pleasure to be here with such great company. Thank you.